Hello everyone and welcome to today's YouTube video. Today's video is about giving soap solution enemas to patient. A cleansing enema is basically the introduction of fluid into the rectum to remove feces and gas from the colon in the rectum. The enema fluid usually creates a sense of urgency in patients. Urgency here means the need to empty your bowel. Solution of enema is usually given for a short period of time for the patient. It is considered that the best position to give a patient enema is the left Sims position. Fluids move into the bowel more easily in this position. We have to avoid giving enemas to patients in a sitting position because the solution will not flow through the colon in the sitting position. It will cause the rectum to enlarge and can cause a rapid expulsion of the solution. Usually disposable enema sets are used. They are easy to use and they save a lot of time. Now let's see how to give a soap solution enema to a patient. Before starting, I'd like to point out that all the instruments used in this video are not real instruments. They are just a recreation of the instruments which are used. The most important equipments used are gloves, disposable enema equipment, plastic container, tubing with rectal tube, clamp, lubricant and soap packet, among other things. First of all, connect the tubing to the solution container. Now, adjust the clamp on the tubing and snap it shut. Thirdly, fill the container with warm water. Now, open the pack of liquid soap and put the soap in the water. Fifthly, rotate the vessel slowly to mix the soap well. At last, run a small amount of solution through the tube to eliminate the air that might be stuck in the tube. Hello Mr. Sushil, are you ready for your enema?
Yes.
Okay, so can you please turn on your side?
Yes.
Thank you. Now please try and relax and take a deep breath. Okay, do you feel any kind of pain or discomfort? Now? So can I proceed?
Yes.
Okay. Now open the clamp and raise the container 12 inches above the level of the anus so that the fluid flows in slowly. Withdraw the tube gently and ask the patient to hold the enema solution for 20 minutes or so, or for as long as the patient can. Some important points to take into consideration are: 1. To never force the tube into the patient. If you are having troubles inserting the tube into the patient, then get help, because there might be a tumor or a mass of feces blocking the bowel. Secondly, if the patient complains about cramping, then clamp the tubing and wait until the cramping stops. Afterwards, then open the tubing to continue the fluid flow. Clamp the tubing before the container is completely empty. Afterwards, when the whole procedure is completed, discard the gloves and wash your hands. After the procedure has been completed, make sure the patient is given his privacy. Place a signal code near the patient, but do check in on the patient after every 5 minutes. Thank you for watching the video.